Okay, welcome everybody. This actually webinar has been organized by I-Inspire since 3 of May, and every month we have actually different topics. And this is our 10 topics, and today we are going to look into some not so common. I know that sometimes we will talk about very common and popular illnesses like pain or diabetes, all these things. Today is some is like quite rare. If you later we share in the video, you can see it's actually quite rare cases. But somehow, when they started to consume the Agni ash, and then when they do Agnihotra, you will feel touched. You know, they really can. So today, we are so blessed and we are so lucky that we have Dr. Abel. And you know where is he today? He's deep in a jungle, Amazon jungle, and he told me today, if let's say there is a rain, he might not able to get the internet to connect to us, and we are so blessed, and I'm so thankful. Professor Abel still able to connect to us, and thanks for the good weather in Amazon. I know Malaysia suddenly just get a heavy rain at least in KL. So this is what today the topic is actually, this is about Dr. Lennie. We have Dr. Lennie again, and who will be share with us what kind of cases that she might met in the clinic. So Dr. Lennie, today we are talking about muscular system disorder. Have you come across any cases in your clinic, Dr. Lennie?
I don't come across a lot of muscular degenerative kind of problems in my clinic because I don't see those kind of patients. But what I have seen is that when people are depressed or when they are absorbed or when they are having some form of addiction, they will experience something called muscular deterioration or muscular atrophy. So there's a lot of muscular atrophy, and I'm seeing in my clinic a correlation between muscular atrophy and those who are suffering from addiction. Specific to that will be, addiction to like cocaine or addiction to amphetamine. There seems to be quite a lot of correlation towards that, and also the loss of muscles, from the body. But I think with this kind of muscular degeneration, age is a factor as well, and I think quite a lot of people who are older, they really need to maintain their muscles. And besides maintaining their muscles, and I think sometimes maintaining the muscles can be quite hard, especially with people that have autoimmune problems and all that. And we haven't really found a way to maybe help these kind of people to improve the muscular composites in their body. So maybe with Homa therapy, we might see a change in that, because Homa therapy, to me, it is amazing because it has been able to cure so many variety of diseases across a huge spectrum, and it would be very interesting in the future for us to know the molecular pathways in which the healing happens. So this is from me and what I think about muscular system. Willing, back to you.
Okay, thank you, Dr. Lennie. Dr. Lennie, we have one speaker, right? Last time, happy hour one, where the tongue actually couldn't even swallow. You remember?
Yes, correct. We have one of those. Now, Huiling, the symptoms that you described, that particular illness is called hemihyperplasia. So hemihyperplasia is sometimes also referred to as hemihypertrophy. And this is actually quite a rare condition where one side of the body or one part of the body, like the tongue, for example, they just can't control it very well. So we have,
Let me introduce today key speakers. Dr. Abel, which is, he's based in Peru now. Dr. Abel, you are in Peru now, right?
That's correct.
Yeah,
We're in Peru.
Amazon jungle. That's why you can see behind him a lot of greens, and his time now is like 7 o'clock in the morning. So this is him. And today this is our topic. We'll talk about muscular system disorder and diseases. Although they are rare, but we do have people suffering from that, and actually medically, they found it very difficult to have solutions for this. So without further ado, I would like to invite Dr. Abel to share with us about his experience by using Homa therapy.
Country, everyone, hello. We are broadcasting from the jungles of the Amazons of Peru. So today we are full of joy, and even more joy because we also have in this encounter, in this meeting, we have Dr. Manuel Guevara. He is right there in the panel. You can see him. Doctor, you can raise your hand. Doctor, usted puede levantar su mano para que lo reconozcan. Dr. Manuel, exacto. You can see him there with the hand raised. He's not only a doctor, he's a doctor in traumatology and sport medicine. And it's not only that, he has been a professor in the medical school in Venezuela for many years on this in this area. So we are very blessed. And the good other thing, he does Homa Therapy. Okay. Entonces, doctor, me pudo entender, ¿verdad? Está hablando de usted un poquito. Profesor en la... Yeah. Okay, so today we'd like to have a little different format for today's presentation. Most people don't know much about these muscular diseases because really there is no pure muscular unless you have a trauma or something like that, but general chronic diseases or genetically they imply different systems. Remember, the human being is not just one system. We have divided the program of this presentation by system, like neuromuscular, muscular system, endocrine system, skeleton, so on. But there is a connection among all of them. For example, let's suppose I have some wrong eating habits and eat in such a way that irritate the mucosa of the GI tract, especially the stomach area. And let's suppose I develop an ulcer, and this ulcer creates some discomfort. That already can affect some other systems. Let's suppose there is some wound, there is an ulcer, gastric ulcer. Okay, if this gastric ulcer start bleeding, we're gonna involve the circulatory system. We might have some the red blood cells count is going to decrease because there is some bleeding. The iron is going to decrease. We might have some anemia. This is going to make the heart work faster, and also it's going to have some maybe induce some tachycardia. All this, and that at the same time, the heart and the lungs are connected. The respiration rate is going to speed up because it wants to compensate. And like that, as I said, the nervous system is involved. Everything. It's not just one thing. One thing is linked to another. We are a set of systems interacting constantly. So there is, in most cases, there is a connection of this. Today, we'll have three cases. One, muscular atrophy or dystrophy. Screen, let's see. 1 second. Now, ready to share. First, we'll talk about the little bit of fibromyalgia. Can everybody see?
Yeah.
Questions about fibromyalgia. 1. What is fibromyalgia? Fibromyalgia, or fibromyalgia syndrome, is classified as a chronic disorder characterized by widespread and persistent non-inflammatory musculoskeletal pain. Common symptoms include widespread musculoskeletal pain, fatigue, insomnia, morning stiffness, depression, anxiety, mental slowness, and memory and attention problems. 2. How common is fibromyalgia? As of 2013, 4.2% of women and 1.4% of men have the diagnostic label of fibromyalgia. but the prevalence of fibromyalgia appears to increase steadily with age in women and peak during middle age in men. Traditionally, fibromyalgia was considered a predominantly female disorder, and it was relatively uncommon for men to receive the diagnosis. Recently, however, Sanchez et al. In 2020 noted that bias within research and clinical practice leads and has led healthcare providers to underestimate fibromyalgia prevalence in men and overestimate it in women. With newer diagnostic criteria and a less biased selection of patients, the male proportion increases to 40% or more. 3. What causes fibromyalgia? As reported by the Canadian Guidelines for the Diagnosis and Management of Fibromyalgia Syndrome, the cause of fibromyalgia is still unknown. However, a host of biological, psychological, and social factors may contribute to onset and severity of fibromyalgia. As noted by Charles et al. In 2012, the expression of fibromyalgia may be explained by a biopsychosocial model in which predisposition, triggering, and other factors such as depression, maladaptive coping, or fear avoidance behavior contribute to chronicity. 4. How is fibromyalgia diagnosed? Previously, Wolf et al. And the American College of Rheumatology created the diagnostic criteria for fibromyalgia in 1990. This criteria included both chronic widespread pain, i.e. pain on both sides of the body, above and below the waist, and at least one portion of the spine for at least 3 months, and tenderness in at least 11 of 18 defined specific locations classified as tender points. Although the tender point examination continues to be widely referenced and discussed, it is no longer recommended within the updated fibromyalgia diagnostic criteria. For example, Charles and colleagues state that, contrary to previous beliefs, examination of tender points should not be used to either confirm or validate a diagnosis of fibromyalgia. Currently, the 2016 revisions to the 2010-2011 American College of Rheumatology diagnostic criteria are utilized as the primary means of diagnosis. There are 2 scales involved, the Widespread Pain Index and the Symptom Severity Scale. The Widespread Pain Index is a list of 19 painful areas with a score ranging from 0 to 19. The Symptom Severity Scale includes 2 parts. The first part evaluates the severity of fatigue, waking unrefreshed, and cognitive symptoms, and the second part is a checklist of 41 symptoms, including irritable bowel syndrome, fatigue, tiredness, muscle weakness, raynaud's, ringing in the ears, etc. Per the updated criteria, there are 3 components that need to be met for an individual to be diagnosed with fibromyalgia. 1. Generalized pain, defined in at least 4 or 5 bodily regions, i.e. left and right upper, left and right lower, and axial. 2. Symptoms have been present at a similar level for at least 3 months. 3. Widespread pain index greater than or equal to 7, and symptom severity scale greater than or equal to 5. Or widespread pain index of 4 to 6, and symptom severity scale score greater than or equal to 9. In the original 2010 criteria, the defined
As you can see, fibromyalgia, it could be a little bit complex. This is not a clinic seminar on this topic. Just an it's unknown. Now, that very brief, very simple. People was the example of fibromyalgia. Went to the Homa Therapy, participated several times to the ASH. And the pains were gone and no more problem. But let's show it. Otherwise, I share it. I have it also, but okay, good. Let's see.
Su nombre, por favor.
Silvana Pérez.
Silvana Pérez. Silvana Pérez. La Agnihotra, aquí mismo en Colonia. Desea tomar cenizo, tomografía, cenizo de Agnihotra y fibromialgia y los dolores en los codos se venía. O sea que qué belleza. Nos mantenemos informados. Gracias.
This is a short video.
Okay, that's good. It was
You interviewed him, right, Dr. Abel?
title. It was a AI subtitle, and it's good. but it was very direct and simple. She was diagnosed fibromyalgia. She have the pains in different parts, like you already know, and then took the ice, did the fires, and the pain is gone. Okay. The most difficult thing to believe with Homa therapy is that it could be so simple and to heal sometimes problems which are very complex, and it makes the mind go a little wild. Anyway, that's the way it is. This was one case of fibromyalgia. Many cases, I'm sure Dr. Lennie have seen a lot of this fibromyalgia, because there is components that it could be psychological and so on, but there is an effect on the body. Okay, now let's go for the next one. The next one, let's go for 1 second. Let me check. Okay, let's show that. This is very interesting. Let me say something about this, please, before you show that. Yeah, before you show that. You see, like Dr. Lennie was talking about, you have seen some cases with people who have drug addictions, and it affected somehow the muscular system. Well, this is something like this, except that it was no some type of drug like people consume, but it is another drug or chemical that have an effect on the muscular system and some other parts. And it was that this man sitting on the wheelchair, he's a farmer, he was working, fumigating glyphosate. Glyphosate is one of the most toxic poisons that is being used in agriculture almost everywhere, even though it has been forbidden in many places, it's still used in many places. And is produced by Monsanto, and super toxic, but it is used. And Homa therapy helps to counteract this toxicity, and at the same time, by doing that, it helps to heal the people in many different ways. But also, when Homa therapy is applied in agriculture, people do not need to use these agrochemicals or pesticides, herbicides like this glyphosate. That is the chemical name, but the brand name is called Monsanto. Monsanto Roundup. Roundup is the brand name, and Roundup from Monsanto. That's what he was using. This is what happened to him. This is also straight. I think he did a good job with this one. So let's see it. Now you can play it. Mrs. Hui, you can play it.
No problem.
Let me share the one that I have. This is let me share the one that we have, okay?
Okay, no problem.
So okay. 1 second. Veamos. Let's see this. Let me do an introduction to Dr. Manuel. Dr. Manuel, este es un caso de una persona que tenía atrofia muscular. Él fumigaba glifosato en sus cultivos y quedó paralizado y no movía nada. Y después de 10 sesiones, hubieron poquito tiempo, pero en 10 sesiones nos dio este testimonio.
I am Francisco Herman. Francisco Herman. You see your brother Carlos Perfecto? Yes, Carlos Perfecto. And he is 49 years old? Yes, 49 years. What diagnosis did the doctor give him? Muscular atrophy. Muscular atrophy. How long ago was that? 3 years ago. What was he working on? In agriculture. Fumigating with glyphosate. So, you tell me that you have brought him 10 times to the Agnihotra. The therapy that we are doing here is 10 times more or less. And what changes have you seen in him? Before, he didn't move his feet at all, and now he has already started to move them. And he didn't move his head either. No, he couldn't move his head. He could not stick his tongue out, and now he has started to stick out. He could get his tongue out, and he's already sticking out. Drinking water with a straw, and he couldn't drink it. So he couldn't drink water with a straw, and now he can drink water straight from the glass. Also, he could eat meat, chicken, or anything like that. And he won't feel happy. Now he eats anything. Without that, he is much better. Is he thinking that we will crash? He's taking out very well. He's coming to the Agnihotra class. We bring him in the morning and in the afternoon very well. Thank you.
Okay. It was amazing because, as you see, he could not move the tongue, he could not swallow, he couldn't move the fingers, he could not do many things. And the amazing, okay, we apologize because the internet is not steady, it's not stable here. But anyway, this in the countryside, the distance are far away, and he was living 2 hours away from this area, from this farm where the Agnihotra was done, 2 hours away. And they will come in the morning for Agnihotra at sunrise. So they had to get up early to be there by 6 in the morning. And then they will go home again, 2 hours more going back. And then they had to come by 6 p.m. to do the Agnihotra at sunset. So they were coming twice a day, 2 hours distance. And that was in a week because it was 10 times. And that's what happened. That is amazing. Such a short distance of time and such a, you see, when we were talking about that, he couldn't move the tongue and he stick the tongue out. When he couldn't move the feet, he started moving the feet. He could not lift the head, he lifted the head. He could understand everything and he was showing that he can do it now. Okay. Now, any question about this one in particular? Then we have another one that we have done it before, but I still find it very amazing, and it has something to do with the muscular system also. It's not just muscular because there is a neural damage. It's not neural damage, only it's a genetic problem, and it might be even traumatic. It may be hypoxia. When it comes to cerebral palsy, it's another story. But anyway, any question about this one? Dr. Lennie, can you hear?
Unfortunately, I couldn't hear what her question is, but I do have a question for you, Dr. Abel. This patient, he was completely paralyzed, is it?
Well, maybe not completely because he was in a wheelchair. You know, so they could sit him, they could move a little bit, but he could not swallow, he could not lift the head, he could not move the feet, but maybe he could move the arms. I don't know, but that's what they show at the time. That he had this. It was a lot of paralysis, and it was a little severe, but it recovered in a week because it was twice a week, 10 sessions.
Yes.
There was
he experiencing the pain? Was he experiencing a lot of pain?
I apologize. I didn't ask him. Chances are there is not much pain because he didn't have any feeling.
Yes, because he couldn't feel anything, right? So there's no chronic.
Yes. That he could not feel and he could not move. It was a sensory and motor problem. It was not just motor. It was sensory also. As I said, this glyphosate is a very toxic element, and in some he hurt some more people. But he was fumigating. He was fumigating the plant with this glyphosate, and that will come and he will absorb it. It will be harm. You have seen the toxicity with drugs and with some other people, but this is even deeper. So people usually don't talk, even in medicine, they don't talk much about this kind of toxicity. They induce the muscular damage and neuromuscular damage and so on. But that's what it is.
Yeah, I think Monsanto, the fertilizer that is used by Monsanto, really had a very bad effect. Yeah.
The Ronda.
Yes.
That's the brand name.
Yeah.
If you search in it, it's one of the most poisonous one. It's one of the most highly used. You will not believe it. It is used in the wheat, in the rice, the almonds, in the vegetables. Everywhere they use this kind of thing, and people don't know about it. They keep it quiet. Where they use it.
Yeah, that's very interesting.
Eating them, then we are actually indirectly we are consuming the herbicide also actually somehow. Another method, if we this, because they are the one that have a direct contact. That's why his case is very severe until he move his tongue.
No, could not swallow. Even with he could not even use the straw. He could not drink with the straw. Can you believe that? It was a very bad shape. But anyway, the beauty of this Homa therapy, this Ayurvedic method, is that it can resolve many problems on the human level, animal and plant levels. It can heal the plants also without the need of any synthetic substances or poisonous or anything. This is the beauty of it. If we didn't have this solution, I will say, go for all the chemicals, all the injections, whatever you want to do. But if we have something natural that can bring balance into the body, into nature, why not? Why not?
That is
Only
true.
Because, So now, one of my favorite testimonies is the one that we're going to show it now. I think we did before. Did we show this cerebral palsy? I think we did before, no?
Yes. We shared before, but I think at least 3-4 months ago.
Yes. So let me show a little bit first what is cerebral palsy. One introduction, because you as a medical people, but some people might not know what is cerebral palsy. And then we show the testimony. Okay, we'll show just an introduction to cerebral palsy, and then we show the testimony. Let's share. This we saw directly when all this was filming. We did a filming, so this is very close to us.
My name is Dolores Marisol Ordóñez Cerdeña.
Today we are at Dr. Abel Hernandez's office. Why did you come here?
As physiotherapist from the hospital brought me. He told me about this, and since then I have attended the therapy sessions with my son.
For how long have you been coming here?
I have been coming here for 7 months, and I have seen many changes.
You have been coming to Homa Therapy with Dr. Abel, and what is the child's diagnosis or problem?
My son's diagnosis is ICP, or infantile cerebral palsy.
How old is he now?
He's 9 years old.
Have you noticed any change since you started coming here?
Yes, many. For example, he didn't babble. Now he's babbling. He didn't move his arms. He didn't even crawl. He didn't walk. He didn't keep his neck upright. Now he does. He didn't maintain the same weight. He didn't go up from 12 to 15 pounds. He maintained that weight for many years. Now he weighs much more. He already weighs 35 pounds.
You have seen all these changes in just 7 months?
Yes, all of these changes.
Does he try to walk?
Now he tries to walk. He gets in and out of bed. And before he didn't. Here he takes off his shoes himself. And
when we do Homa Therapy, remember, we take off the shoes. When we do Homa Therapy, we do grounding to capture the energies of the sun. He learned to do all this. He couldn't take off the shoe, he couldn't walk, he could do anyway.
when it's time to, he takes off his shoe. He tries to help himself get dressed. He already picks up the pencil. He picks it quite easily. And before he didn't. Now he stays put in the chair when I sit him down.
So blues, when they are at the beginning, they cannot even sit, they just like a gelatin. But then he could sit.
He stays in the chair. He's at a normal school.
Normal
And the teachers are amazed because he is the first to finish the homework. And even I am surprised. They call me in the first quarter of the evaluations. And to be honest, I thought they were calling me to remind me of the school fees.
I work with many people who really don't have many financial, they don't have money. And this lady could not. And so they called her and she thought that because she have not paid anything, but no, that was not the case.
Because I hadn't paid him yet. But I was surprised that my son was among the first 3 students.
So well, he was among the first 3 students, top students.
I didn't imagine he was the first. I imagined that he was the third. But when they gave me the news, I was surprised because he was the best student. My son got a gold medal in school.
Incredible. What is his name?
Name is Guillermo Alfredo Carmona.
And all this has happened in the span of 7 months?
He's right there on the right side, he's like opening his mouth. He's chanting the mantra there. The other one that is in the front is his brother.
In the past 7 months.
The hands together when we do the Om Shri, he likes to do it with the hands together.
Can I ask you a question, please, Marisol? In these 6 months, how much money have you spent here with the treatment?
$2.
Totally free.
This is a free service the doctor was doing during the 6 months coming over there. She only paid $2 the first time to the taxi that brought her over there.
Let me ask you, if you met a mother with a child who has similar problems, what would you tell her?
I tell her to come to Homa Therapy as soon as possible because Homa Therapy has done miracles. Many miracles for my son. I'm glad. I'm that angel who was the therapist that brought me here. And the doctor that
The physical therapy in the hospital was the one who referred her. He said, go to this Dr. Montúfar, he can do many things. Go there with Homa Therapy, you'll see, you tell me what happened.
has helped me a lot because he has helped me gain the courage necessary to continue dealing with my son's problem.
Dr. Montúfar. Now it's much bigger. So crowded. None of these people paid $1 for participating. I was in the clinic in the doctor's house. Right now we're in a festival, and this is a university, Salesian University. This is a Catholic university, and this is the chapel of the Catholic. Normally, people, this religion, this whatever, but this is nothing to do with religion. It can be done anywhere, and all these people, hundreds of families with the pyramids, were participating, and look at all that amount of people. And this is two levels. This is the first floor and the second level, all participating on this.
A big round of applause for the child who is already walking, and also for his mother.
Remember, he could not lift his head, he could not crawl, he could not do much of anything. All right. Hard to believe. Do not believe anything. Or maybe I'm paying this little boy to play all these roles. You never know. And
I
then you
have-
put into the practice.
I have some questions. May I? Sorry, I'll start my video.
Yeah.
Dr. Abel, I have some questions related to the Agnihotra. I mean, I used to do so. Okay, the questions in my head are this: one, if the person can't go and attend Agnihotra or have it done physically, just taking the ashes alone without attending Agnihotra, could that help?
It will help. It will help, but it will be a partial treatment. It will not complete. It will not be a complete treatment because Agnihotra Homa Therapy implies taking the ash and being exposed to the radiation of the fire when that
Yes.
is lightened and breathing in that smoke. So
Okay.
it's different gates. One is through the mouth, one through the nose, one through the skin.
Yes.
The radiation goes to the skin, and then in a very subtle way. And we could say even through the ears and the eyes, because that light and those sounds or the mantras that we produce, they do have an effect. We know that for a fact. So, the full treatment will be better. Second to that, it's partial treatment. We have people who have, they come to the hospitals and they have relatives who can move. They're in bed, they can move, and they participate in the Homa Therapy. They take the ash and give it to the relative in bed, and it helps them over there. But once they themselves, they go home and they do the fire in front of the patient, they get more benefits. And once the patient himself try to do the practice, is much more. So gradually you do the best you can, and like we say, let the divine do his part. We don't do anything. The divine, we surrender to the divine when we do this. Let the divine will be, and that's what's going to happen. And that's what usually it is.
Thank
we cannot
you.
promise anything. We cannot promise anything except that there's going to be some well-being. Up, the whatever is just divine. Whatever happens, even if you have to leave the body, you can leave the body happily without pain and anger and sorrow and resent or resentment or anything like this. Okay, so whatever it is, it's gonna be good.
Thank you.
We die every day. Remember, we die every day. When we go to sleep, we lose consciousness completely. Okay, but our attachment here is what that is difficult to break.
Yes.
But we can be free like a bird, and we'll be free like a bird even without this boy when the time comes, isn't it? We will.
Thank you.
Okay. Thank you, Nahalana.
Nalana. Yes.
Nalan. Thank you.
Thank you.
Okay, more comments or questions? Aha. Let me ask Dr. Manuel. Dr. Manuel, si usted quiere compartir alguna de su experiencia en el sistema con los músculos, con la parte muscular o el sistema muscular neuromuscular, yo le puedo traducir. Si usted quiere compartir algo, decir algo. No se le escucha, doctor. Está el micrófono cerrado. El micrófono está cerrado, doctor.
Ya se abrió. Ok. Muy buenos días para nosotros, los de este lado. No sé a qué hora estamos en Malasia.
Ajá. Allá son, ¿dónde está usted ahorita? ¿En Colombia o en
Bogotá? En Bogotá,
Bogotá.
en Colombia.
Okay, permítame. I'm asking Dr. Manuel. He's in Bogotá, Colombia. I'm in Peru. I already told you what his qualifications not only as a medical doctor, but a professor of medicine in the university in traumatology and sport medicine. So muscular to him, this is and he does Homa Therapy. So I asked him if he want to say anything, I will translate for him because he does not speak English. He understands, but he doesn't speak that much. So
can you ask the cases that he has? Can you ask Dr. Manuel Guerra to tell us some of the cases that he has dealt with?
That's what it's, doctor. La doctora Lennie pregunta que si usted puede contar algo de sus pacientes.
Claro que sí. Nosotros podemos contar de que toda fibromialgia o toda patología tiene un comienzo, una causa, ¿verdad? Esa causa está determinada en la condición de la mente, en el proceso pensante del ser humano. Este proceso,
Dr. Manuel saying yes, he's happy to share, but according to his experience, a great deal of these problems, muscular problems like this, also have a mental component, mind component, or mental component. Okay. Doctor, sí puede decir.
Ese proceso pensante crea dolor, crea estrés, crea angustia. Hay una dicotomía en el proceso pensante, que es crear el dolor, crear el estrés y crear esa desarmonía que normalmente crea un pensamiento de cualquier índole.
So he said that sometimes this kind of erroneous way of thinking and the stress creates some discomfort and pain. It's like two different versions, and it originates the pain itself. Okay,
nosotros tenemos que aprender a que la energía ni se crea ni se destruye, solo se transforma.
So we realize that we do not create or destroy anything. The energy only transforms, modifies, but nothing is created nor destroyed, just changes.
El pensamiento es energía eléctrica.
The thought is like some type of electric energy.
Por lo tanto, le aplicamos el concepto, ¿verdad? Que la energía ni se crea ni se destruye, solo se transforma.
So we use that. We only transforming, changing the energy with these processes.
es muy interesante regresar a la medicina ancestral con una base donde nosotros tenemos que aprender el hábito de no pensar.
It is important. This is very interesting. It is important to go back to ancestral medicine, ancient medicine, where we do not have to think too much. Ok, le escuché. Muy bien, doctor.
Ese pensamiento, ese hábito de no pensar es lo que se denomina conciencia.
The no thinking habit, in this case, is what we call consciousness.
La conciencia es la sintonización de la frecuencia universal de vida.
So this consciousness is when you synchronize or get in tune with the source of life.
Es como cuando uno está sintonizando una radio, ¿no? Busca esa frecuencia en la radio.
It's like as you are tuning into a radio station, you look for the frequency itself.
Al sintonizar el hábito de no pensar, la conciencia se pone en actividad y la armonía, el equilibrio pasa a ser parte natural de todos nosotros, sobre todo del espacio mental.
So as you get in tune with this consciousness, or automatically there is no thinking, but there is harmony.
De esta forma, el cuerpo mental no afectaría al cuerpo vital. El cuerpo vital está dado por el sistema endocrino.
By doing this, the mind will not affect the subtle bodies, and there will be no physical discomfort. Okay.
Por lo tanto, la producción de adrenalina y las consecuencias de crear una tensión permanente muscular o una tensión permanente del sistema nervioso físico, no se desarrollaría la fibromialgia.
So, when there is no that continuous production of adrenaline, there is no continuous stress, and there is no fibromyalgia. Okay, doctor.
Entonces, aquí es donde vemos la magia de la terapia Homa.
This is how we can see. That's how we see Agnihotra, almost like magic. They just can do this.
Porque ella es una vibración, ella es una frecuencia.
Because this practice is a frequency, is a vibration.
Que armoniza y sintoniza en mayor grado y en mayor posibilidad esa mente y ese cuerpo vital de cada uno de nosotros.
Because this Agnihotra helps to tune in and synchronize these vital bodies, subtle bodies, with that source, with the divine source.
Entonces, para probarlo, gracias a Dios y a la Agnihotra, ¿verdad? Porque probándolo con la mano, yo tenía este dedo así, ¿no? En esta forma, no lo podía extender.
He developed a problem with a finger that he could not open up that finger. He got a problem, and he could not open the finger well. Even though he's into sport medicine and dermatology and all this, that problem, he had a problem. Okay, doctor?
Entonces metí la mano dentro, en el momento en que ya se acabó el fuego, dentro del humo y dentro de la vibración de la pirámide del Agnihotra.
He placed the hand around the field of the Agnihotra. While the Agnihotra was done there and finishing, he placed the hands inside that field and something happened.
Al otro día, como un día como hoy, noto que el dedo está extendido, que ya el dedo no está encogido, tieso, ¿verdad? Duro. Entonces, para mí fue...
Next day, was surprised to realize that the foot, I mean, the finger was straightened up and there was no tension and it was moving easily. That was a surprise for him.
Entonces, todo el proceso científico, porque la ciencia es una sola, ¿verdad? Y es universal. Se basa en los tres procesos que hay que aprender de la misma naturaleza, de la misma madre naturaleza, porque nosotros tenemos que entender que la madre naturaleza y nuestro creador, el espíritu del sol, se compaginan para enseñarnos todo su poder y toda su capacidad universal para darnos la vida y sostener la vida. Eso es más o menos un resumen de lo que me han permitido comprender y estudiar, ¿no?
Gracias, doctor. Thank you. So this is says you can see how Mother Nature and the divine express himself through the sun and the nature and this energy, and this is why he have been received, what he have captured, what he have learned, realized through the practice of Agnihotra. He does Agnihotra every day, morning and afternoon. Every day he sends me pictures of that. So I invited him because he lives what he talks about. Le estoy diciendo que lo que usted habla lo está viviendo. Y por eso es un gran honor para nosotros tenerlo aquí, lo que está diciendo. No es de libro, es de vivencia.
No, es de experiencia, vivencia, del día a día de la práctica de la terapia. Y de muchos pacientes.
He's talking about his own experience with Homa Therapy and what the experience he have with many patients. So this is what it is. Gracias,
I think
Dr.
Guevara is amazing. I mean, his experience with Agnihotra has been amazing, and as a dermatologist, working with Agnihotra, I guess it really works, isn't it? In a lot of ways. I just have a question that Charlene is asking him. If the Agni pot direction to sunrise or sunset is not very accurate, that means if it's not directly facing the sunset or sunrise, will it actually cause a problem in the healing energy? Can we ask Dr. Guevara this question?
It will not cause any problem. It will not cause any problem. You try, the ideal is to be facing east with the pyramid facing to the sunrise, and as sunset you could be facing still east. But if for whatever reason you are not facing it, you're whatever, there will be no problem. One thing is the ideal, but definitely there will be no problem. There is no negative side effects. Me está preguntando que si puede haber un efecto negativo cuando uno se mueve un poquito haciendo la Agnihotra, ¿verdad? De orientación. Digo, no. Lo ideal es mirar al sol en la salida, a la salida del sol, y si es posible mantenerse mirando hacia el este, aunque sea pero este, oeste, norte o sur, no va a haber problema. Lo ideal es una cosa, pero si uno fallara, no hay efecto negativo.
Es correcto. O sea, no hay un efecto negativo porque precisamente hay un control, ¿verdad? Hay un control del cobre de la pirámide tenemos que entender que el cobre tiene una funcionalidad atómica y una frecuencia. Esa funcionalidad hace que la energía, como es una cámara invertida, es una pirámide invertida, la energía va hacia arriba, hacia la atmósfera, y que por eso se produce la purificación de la atmósfera. No va a afectar porque la frecuencia y la vibración de esa energía precisamente es con uno de los elementos de la creación de la naturaleza, que es el fuego, ¿verdad? Ese elemento puede ser destructor y eliminador de sustancias tóxicas, pero desde la frecuencia de la vida en sí es maravilloso, nutre a la vida misma y a la vibración de la vida. O sea, no sé si me estoy explicando bien, porque uno puede comprender algo, pero a lo mejor no lo puedo explicar, ¿verdad? O sea, la energía de la vida está determinada por los 5 elementos que la constituyen. Esa vibración no va en contra de la vida, esa vibración va a favor de la vida, pero sí va en contra de las toxinas, va en contra de la desarmonía, va en contra de muchos aspectos que es lo contrario, es la muerte de la vida. O sea, eso es lo que he podido comprender en la práctica. ¿Cuál es la causa? ¿Cuál es el fundamento científico de la Agnihotra? O sea, ¿por qué es tan mágico, tan poderoso en transformar y curar y sanar? Precisamente porque es un elemento, uno de los 4 elementos que se está usando y le pertenece a la naturaleza, le pertenece al universo, le pertenece al cosmos. O sea, es extraordinario verlo funcionar desde ese punto de vista.
Okay. Para traducir entonces. So he's talking about, like, you know, the divine. I'll try to summarize what he's saying. It's like, you know, the divine is expressing himself through the 5 elements, and in this case, especially through the fire. And this fire has the quality that in whichever way operates is never opposite to life itself. Contrary, if there is some toxicity, if there is some disharmony, anything that is out of balance, this fire energy will bring it into alignment. And that's why, for him, according to his experience, there is no problem, even when there is certain little details like that, which are not exact. I think, for me personally, I know this is difficult to explain a little bit, but this fire is love, and love is always good. Unconditional love. Yo le digo a la gente, le estoy diciendo, doctor, acá que otra forma para mí es explicar esto, vea, este fuego que hacemos literalmente es amor, y el amor siempre es bueno cuando es un amor incondicional.
Muy bonito, muy bonito, sí, porque eso es, en sí, eso es. O sea, solo que en ciencia, pues también tiene su explicación, ¿verdad? El amor lo cura todo. O sea, eso está determinado.
There is language and language. The language for the brain, language for the intellect, maybe language for the tongue, I don't know. But there is a language for the heart. And when you get with that language, everybody.
Sí.
¿No? El lenguaje para todo, el lenguaje para el cerebro, el lenguaje también para la lengua. Pero
está muy correcto. Ese lenguaje es de, o sea, se ve el amor de la madre naturaleza, porque la madre naturaleza interior también es madre de la naturaleza que nos rodea, ¿verdad? La madre naturaleza interior tiene su representante, y esas son las células madre. Las células madre tienen el poder plenipotenciario de curar cualquier afección. O sea, solo que nosotros quisimos usarlas y no entendimos que el universo tiene el dominio de esas madres, células madres, para curar cualquier enfermedad. O sea, es decir, el aspecto plenipotenciario de curación en la misma madre naturaleza interior no se pierde. O sea, si el universo y nuestro creador así lo quiere, activa esas madres, células madres, para que se repare cualquier órgano y lo repara íntegramente. O sea, ese es un aspecto que uno queda sorprendido de ver la capacidad que tiene esa naturaleza, ese fuego, esa energía, cualquier forma, ¿verdad? Pero llevándonos siempre al hábito de no pensar. Es una condición sine qua non. O sea, lograr el hábito de no pensar es salirnos del dolor, salirnos de la falta de amor, del odio, del resentimiento, ¿no? Porque son vibraciones que van en contra de la vida.
Ajá.
Cualquier patología es curable. Cualquiera.
Okay. He's, Dr. Guevara is talking about the mother cells, or the mother cells that have the possibility to transform and take the shape of whatever is needed. And I just wanted to show you a little bit of Mother Earth here.
It's beautiful. The glass house and everywhere surrounding. Yeah.
Of the mother here, and this is called this foundation. This house is a mother. It's called Madre Selva. Madre Selva is Mother Jungle. That's where we are now, and I'm just walking through again into the room. Just show you a little bit from the outside because it happened to be that the rain a little stopped, so that we have some chance here. It's all around, but anyway, I will not take much more of your time now. We have been. Gracias, doctor, por su presentación. Estoy hablando, esta casa se llama la casa de la Madre Selva, hablando de madre. Esta es la Fundación Madre Selva.
O sea, no hay casualidad, hay causalidad. Sí.
Okay. Mothers, thank you for bringing your light and love into this meeting. Okay, gracias a todas las madres por tener este encuentro.
Thank you so much. Yeah.
Do not believe anything, only your experience. No, and like Dr. was talking about, don't think too much, connect with the divine consciousness. No pensemos demasiado. Okay, a fire, this healing fire, connect with the divine.
Thank you. Gracias.
Okay, I'm so.
Gracias.
Dr. Lennie. Gracias. You can
Not ending yet. The meeting is not ending yet. Oh no! Everybody, because we are so grateful, then everybody thought
Eso nos ayuda mucho.
Gracias, doctor. Ahora me parece que Mrs. Hooi va a despedirse. Okay, Mrs. Hooi. Now you and Dr. Lennie.
We are so glad. We are so grateful that actually two doctors from the other part of the world can join us in Malaysia tonight. And this is our 10th series, and we still have a few more. And actually, our last one will be in October. It's very fast. Already 2024. When we started that time, I said, so long, so many series later we can. But yeah, we are almost there already. So thank you everybody who has been supporting this webinar. So if you think you have any friends around you who might be suffering from some of the illnesses or from different body system, please invite them whenever we share out the poster. Please invite them to join us because there's always hope. There's always light that is what actually Homa Therapy can bring to us at Agnihotra. So the next one that we are going to share with everybody is that the next series, which is in March, we were talking about lymphatic system. Lymphatic system is like, I think that it felt like the river, like passing through our whole body, and whenever anything, and is the guardian for our immune system. So whenever we have something, a virus and attack, it plays so important roles, and many people are suffering in silence. So we will be sharing some cases and testimonial about lymphatic system for next month. So the date is on 11. So it's 3 days after our Women's International Women's Day. So everybody who actually I know a lot of friends around me, especially after the vaccination, many of them have this issue. Just that, not actually, nobody is like openly sharing this lymphatic system issue. So if you have any friends who have this problem, please invite them to meet us online, since we can meet anywhere. Please join us on the 11th of March. Okay, so this is our next series. And then normally 2 days after our webinar, we will have a group Agnihotra, but because now it's still Chinese New Year, at least for Malaysian here, we are still Chinese New Year. So we will combine both. We will celebrate Chinese New Year together with the group Agnihotra. We don't have a space like doctor in Peru and Ecuador to do like a daily Agnihotra to help the patients. But what we have here is like a monthly group Agni that we can do together. At least that those that have problem or they have anything, then we can share together. That is what we are doing. So it will be this Sunday, and just come early at 4 o'clock, because just before Agni, we will do the Chinese New Year, just a blessing and gathering together. So this is the next event that we'll be having for I-Inspire. And the last one, if you want to know more about any like updates, for example, all these webinars will be like uploaded in YouTube. And then if you want to know what is our next one, when is our next topic and all these things, please just like our social media. This is as above. You can screenshot this, and then we will normally update in all our like Facebook and Instagram. Okay, and we really, really, really thank you everybody for staying with us for the past 10 months. This is like a mission impossible initially, but we are there. It's actually a 16 months project, but we are almost there. It's 10 months already. Yeah, time flies, right? Yeah, this will be my last slide, and thank you everybody who joined us tonight. And before everybody go, we need a group photo. Okay? Yeah, someone.
No photo.
Yeah, just the best smile of tonight. Yeah. Oh, that is me. Wait, I have to unpin.
Thank you.
Thank you, everybody.
Bye.
Keep shining.
We celebrate
Keep
together.
smiling.